Hello, I am Dr. Vikas Gorhe, gynecologist, fertility specialist and laparoscopic surgeon, Nashik. Today I'll be talking on a subject which is very much asked by all my patients and the pregnant ladies, that is exercise after the cesarean delivery. Cesarean delivery occurs when it is medically indicated in a woman who is about to deliver or who has completed full term of the pregnancy period of her 9 months. Since it is a major surgery, it has got definitely more recovery time than the normal delivery. Cesarean delivery occurs by taking the cuts on the various layers of the abdominal wall, that is tummy, and these layers are cut in a serial way, so the abdominal muscles are split and the various layers are cut. So this is done so as to deliver the baby in a quick and safe way as per as the indication of the cesarean is concerned. Since it is a major surgery, your treating gynecologist is the right person to guide you regarding the exercise after your cesarean delivery. He will tell you exact movement which you should do and when you should start the exercise and what kind of gentleness you should adopt while doing this exercise. He is the right person. Today in this video, I will be giving you few tips very briefly about the exercise after the cesarean delivery. Usually this exercise after the cesarean delivery are started after 18 to 24 hours with the gentle kind of activity and physical movements, which are done with the help of nursing assistant or a midwifery assistant or a available relative along with the patient. Generally, in the cesarean delivery, in a pregnancy period, the abdominal core muscles and the lower back muscles and pelvic floor muscle become weak. So, aim of our physical movement or the exercise should be to do the exercise of these muscle groups and strengthen them. On the first day, when patient come out of the anesthesia, that is after 6 to 8 hours, we generally ask patient to do leg movements, which includes bending and straightening of the knees, then side to side movements of the hip, then rolling over of the patient on side to side. Then after these movements, once 24 hours are over, then we ask patient to sit up on bed with the help of relative or the nursing assistant. Once she is comfortable in sitting position, then we ask her to get up from the bed and walk for a little steps or few steps in her room itself. Once she is comfortable in that, then after 48 hours, we ask her to increase the duration and speed of walking. This kind of walking exercise in a first 24 to 48 hours definitely help her to recover fast after the cesarean section delivery. After 48 hours, mother is advised to increase her walking duration and distance so as to gain her physical confidence and physical capacity in walking exercise. But one care must be taken after 48 hours to subsequent 15 days, that she should not lift a heavy weight, which is by lifting her baby for feeding or by lifting some required things which are heavy in nature. While doing so, while lifting the baby and lifting the heavy weight, she should take assistance of some of her relative or some nursing assistant, so that it will not cause a stress and strain on her wound and stitches which are fresh in nature. With this kind of gentle activity and walking exercise, if she continue this exercise for 45 days, she attains a normal physiological profile after 45 days, which is a normal postpartum period. After 45 days, her gynecologist and her medical consultant, if they permit that her wound is healthy and strong in nature and her physical medical condition is good, then she is advised to go for next level exercise and which can be done at home without any gym equipments, and to mention few of those exercises which can be done at home itself and in a cesarean section woman, which are enumerated in subsequent part of the video. To mention few of the exercises which can be done at home without any gym equipments or weights, is first exercise is belly breathing. Belly breathing is a great relaxation technique, and this exercise gives a very gentle exercise to the transverse abdominal muscle and the lower abdominal core muscles in a very gentle way. This can be done by lying on a bed or lying on ground and putting the both hands on abdomen and taking deep breath by nose and exhaling by mouth. But while exhaling, you should pull your belly button inside till your spine and hold for 3 seconds. And this can be done 10 repetitions and can be done 3 times a day. This is a great exercise in a very gentle manner to all core muscles of the abdomen without affecting the stitches. Seated Kegels exercise are the next set of exercise which can be done for the by the woman after the cesarean section. Generally, this Kegel exercise is done to activate and strengthen the pelvic floor muscles. These pelvic floor muscles become weak in whole of the 9 months and after strenuous labor and cut, which is called as episiotomy, which is given in normal labor. And as far as cesarean delivery is concerned, because of wound over the abdomen and urinary catheter kept for draining the urine after the cesarean section, this pelvic floor become weak. So in order to strengthen this pelvic floor muscle, this Kegel exercise is the excellent exercise. This is started generally after healing of the wound of episiotomy in normal delivery cases, and as far as the cesarean section delivery is concerned, these Kegels exercise are started after removal of urinary catheter, which is done usually in normal all cases of cesarean where there is no complication, which is removed after 24 to 48 hours. So this Kegel exercise is started after removal of urinary catheter. This Kegel exercise is nothing but contracting the muscle around the urinary passage, that is urethra, vaginal passage, that is vaginal opening, then the anus, which is the rectal opening. And this kind of exercise, this Kegel exercise can be done in sitting position anywhere. The repetitions for this contraction of this Kegel's exercise is done 10 times and hold for 5 seconds, and these repetitions can be increased, and frequency of these sets can be increased in a day, and you can achieve the maximum strength in the pregnant mother's pelvic floor muscle, which is the most important in her further activity of urination, sexual activity and defecation activity. Next exercise is the wall sits, which is the excellent isometric whole body exercise, which is advised for the cesarean section mother, in which the lower abdominal core muscle gets the exercise. Along with that, the thigh muscles, pelvic floor muscles, hamstrings also get the exercise. So this is also a great exercise. As shown in the pictures, it can be done. Next is wall plank rotation. In the wall plank, as shown in the pictures, starting position is taken, then the whole rotation is done, and in that rotation it is hold for the 2 seconds, and again the returning to the starting position is done, and done on the each side as shown in the pictures. Then wall push-ups is the next exercise, in which as shown in the picture you have to stand on the wall with the push-ups like position, and you have to do the push-ups on wall as we do the push-ups on the ground, and this can be repeated for 10 repetitions, and these repetitions can be increased, and these are the excellent exercises for the lower abdominalis, lateral abdominalis muscles and transverse abdominalis muscles, and this is the very excellent exercise for all cesarean section patients which are recovering from the cesarean section delivery. Then next exercise is a cat and cow position. As shown in the picture, it is done 10 times in a cat position to cow position to cat position. It gives excellent exercise to the lower abdominal core muscles, transverse abdominalis muscle, without affecting the stitches area or wound. Then next exercise is the leg slide exercise, in which various kind of leg slides are done, in which the lower abdominal core muscles gets the exercise. Along with that, the pelvic floor muscle get the exercise. There are various types of leg slides which are enumerated in a next part of the video. Types of leg lifts are supine leg lifts, dead bugs and quadruple leg lifts. And 10 repetitions of all these leg lifts are done in a serial manner. And after doing all these exercises which are enumerated in this video for 3 months, she gets a confidence for next level exercise, and those next level exercise after 3 months are swimming, jogging and cycling. After 6 months, she can consider joining the gym, high impact exercises like Zumba dance, aerobic dance. Definitely exercise makes woman after cesarean delivery mentally and physically fit, but it should be always under the guidance of her treating gynecologist. And every woman is having her own body capacity and body stamina, so these all exercise guidelines are tailored according to the everybody's stamina and body condition of that cesarean section woman. If you have got any query on this subject, please contact us on our phone number. If you like this video, share it, subscribe it, and we will meet in next video on another subject on women's health. Thank you very much.